Good afternoon, everybody. I'm Doug McGowen, Chief Operating Officer for the City of Memphis, today representing the Memphis and Shelby County Joint COVID-19 Task Force. Joined today by Dr. Bruce Randolph from the Shelby County Health Department. Give a bit of an update on vaccinations, and then I'll hand it over to Dr. Randolph for any questions. So we've delivered now more than 928,000 vaccinations here in Memphis and Shelby County. 53% of all Shelby Countyans are vaccinated. That's 496,000 people. 42% have received the full vaccination. That's just a few under 400,000 fully vaccinated people. As you know, we have been administering booster doses of Pfizer, and we will continue to do that for the foreseeable future. So if you have been fully vaccinated for at least 6 months, if you're 65 or older, or if you're 18 to 64 with an underlying condition, we encourage you to go get that booster shot if you're so inclined. You can go to any of our public sites. The Pipkin building has been administering these for a few weeks. Southwest Tennessee Community College started last week, and they'll be there tomorrow and Saturday. And tomorrow you'll be able to go to Germantown Baptist Church to begin getting a booster there if you would like as well. So Pipkin building, Southwest Tennessee Community College, and then tomorrow at Germantown. Now, Southwest Tennessee will be open on Fridays and Saturdays, about half a day Saturday from 9 to 1. And the Germantown site will be open tomorrow, which is Friday, and then next Tuesday. So they'll be open Tuesdays and Fridays for the foreseeable future to get your booster. Many people have asked about what if I got the Moderna or the J&J vaccine. A lot has been in the news about those vaccines, and the folks at the Food and Drug Administration are actually examining whether or if they should approve boosters for both Moderna. So on October 14th, they have a subcommittee that will be examining Moderna boosters. On October 15th, they will look at J&J boosters. And then on October 26th, they will examine 5 to 11-year-old efficacy of the Pfizer booster. So there is some more news coming in the future from the Food and Drug Administration. Obviously, they make their recommendation, then the Centers for Disease Control makes a recommendation, then the state of Tennessee will give us guidance based on that recommendation. So I would suggest that by about November, the first part of November is when we should have another change potentially on additional available boosters. So stay tuned for that. We don't have any guidance right now. Today it's only for Pfizer, 65 and older, and 18 to 64 who have some underlying conditions. Now, we appreciate folks coming out to get vaccinated. We have been sharing the word. As you know, we've been knocking on doors in zip codes like 38109, 38126, 38118, 38115, and 38114. Those are the areas where we see the highest incidence of COVID-19 and the lowest uptake of vaccine rate. In September, we knocked on just under 7,000 doors. And just this week, we've knocked on another 1,000 doors. And we're going to continue that campaign all the way through November, trying to get as many people coming out as we possibly can. Our phone bank continues. They've made just under 100,000 calls, 97,000 to be exact, and they've talked with 53,000 people. And we hope that that is part of the reason that people are getting their education and coming out to get vaccinated. We do have an exciting event tomorrow aimed at our young people. The City of Memphis Office of Youth Services and our Human Resources Department are putting on a youth symposium tomorrow, the October 8th, and it will be at 9:01 in the morning. So it's a virtual platform for students where they can learn, students and their parents can learn more about the COVID-19 vaccine. You see the information there online. You can go to the youtube.com page for the City of Memphis, or you can go to the cityofmemphis.gov page and you will see a link there for this streaming event where you can get more information as a young person or a parent about the safety and efficacy and availability of COVID-19 vaccines. And so I will end my comments there. I'll be back for questions if there are any. For now, I will turn it over to Dr. Bruce Randolph, the health officer for Shelby County, Tennessee. Dr. Randolph.
Thank you, Mr. McGowen. Greetings, fellow citizens, Shelby County. I'm Dr. Bruce Randolph. I'm the health officer. I'd like to just share the update in terms of our data and like to share some slides if we can. So we're reporting today 143,267 cases that we've experienced during this pandemic. Today, the new cases are 294. This is down from 350 this time last week and 423 2 weeks ago. The 7-day average of cases per day is now 237. The average continues a downward trend from 302 this time last week and 399 2 weeks ago. We also continue to watch the pediatric cases closely, and today we report 823 active pediatric cases, which is down from 1,140 last week and 1,788 2 weeks ago. Pediatric cases comprise 30% of all the cases. However, this is down from the 31.4% and the 33.4% 2 weeks ago. So pediatric cases are showing a downward trend as well. Next slide. And so our test positivity rate continues to decrease. It is down to 6.9%. That means 6.9% of the tests performed are positive. This is down from 8.5% last week and 10.6% 2 weeks ago. Next slide, please. Our effective reproduction number, which is a measure of the transmission of the virus, is down to 0.74. This is the lowest that it's been since the pandemic. And what this means is that the virus is no longer being transmitted whenever the effective reproduction rate is below 1. And our current reproductive rate is 0.74. Next slide, please. When we look at our active cases by their age, we can still see in all age categories a downward trend compared to a week ago. However, we also see that still the rates are high among our pediatric population, 0 to 17. We are hoping that the downward trend will continue and that number will even get lower once we get the vaccine on board for even the younger age group. Next slide, please. This slide really depicts the fact that we have our highest concentration of cases in the zip codes that have the lowest vaccination rates. So it's pointing to the fact, another way of looking at this is that our lowest active cases are in the areas where we have our highest vaccination rates. Therefore, it is very important, and this slide provides the evidence that getting vaccinated leads to decreased cases. So we really encourage everyone to get vaccinated, and we're paying special attention to those areas that have low vaccination rates. Next slide, please. As you well know, that we had set our goal to be 70% of the population to receive at least one dose of the vaccine. Currently, we have 52, almost 53% of the population that have received at least one dose, and we have 44% that have been fully vaccinated. And we're still continuing to encourage people to get vaccinated. And this brings me to another point that I like to make and highlight. The goal is for 70% of the population to be vaccinated. And I really will encourage that that be a goal in any setting, whether it's a congregate setting, whether it's within a family, school, workplace. We try to get at least 70%, if not more. The more, better. But the good news today is that we reached that landmark in the Department of Corrections. Shelby County, and I'm sure you saw the commercial appeal article this morning, whereby the Shelby County Department of Corrections obtained that 70% vaccination rate among its inmates. And that is an example of what can be achieved with first talking to people, explaining the information, the facts about the vaccine, addressing any particular concerns or questions that they may have. Talk with them, not to them. Accepting people where they are, respecting them, respecting their choices. The other important thing I think that this achievement brings out is that if we're going to get to 70% vaccination, it's going to require peers talking to peers, people who have credibility, people who the person on the street respects, the person in the home, the patient going to their primary care doctor. That's what's going to get us over the goal. And so I encourage everyone, when you go get that third dose, bring with you someone who needs the first or the second. When you are talking to loved ones and families, encourage them, share with them your experience with the vaccine and how it helped you. We still look at our data, we still see that 86% of those who are hospitalized, severely sick, are dying, are those who are unvaccinated. So as Mr. McGowen, Chief McGowen, highlighted, we have vaccination sites, Germantown, Pipkins, First Baptist, but also we have a new vaccination site at 814 Jefferson at the Health Department. We have resumed providing the vaccine. You can come Monday through Friday, 8 a.m. to 4:30 p.m., and you can come and receive your vaccine. Currently, we are offering Pfizer, but we hope to offer, or will be offering, the other two, Moderna and J&J, sometime in the future. With that, I will stop and entertain any questions you may have.
Dr. Randolph, my question is to you. Hospitalizations this week are at 313 combined COVID-19 hospitalizations. That's down from 370 a week ago. The rate of decline for hospitalizations seems to be slowing down. Is that something that the health department is considering when discussing extending or lifting the health directive regarding masks?
Well, not so much the rate of hospitalization, that's one factor, but we're also looking at still cases, 7-day average case. Of course, the transmission rate is down below 1, which is great. It's in the green. We're looking to get other parameters in the green, such as new cases. The 7-day average new case would be important. measures that we will follow as well.
And by in the green, sir, for new cases, what level would that be?
Well, my desire, my goal is to be where we were in June. Around June 21st, if my memory served me right, I think we were like 22 cases per day. And that's where we want to be, so that we don't want to prematurely take our foot off the gas. We want to keep going, encouraging people to wear their mask and keep getting vaccinated, and let's keep doing what we're doing so we can get there.
Dominique Dillon, Fox 13.
And with data looking better, how do you guys plan on making sure that we continue to see this downward trend into the holiday season? And then what would you say has contributed to us seeing this decline?
Well, I think there are a combination of things. I believe that the mask mandate for indoor settings has played a major role. People are getting vaccinated, though we would desire the numbers to be higher, the rate to be higher, but people are getting vaccinated. I think we're averaging about 1,000 a day or something like that, almost a little under or above, depending on which day. And then the other thing is that we don't talk much about is that people who have gotten infected have some level of immunity. And so once a population gets either vaccinated or natural immunity through infection, then the number of people available to get infected decreases because the number of vulnerable people decreases. So I think it's a combination of things that we're seeing play out here.
And then as a follow-up, in the next few weeks, the vaccine could be available for kids 5 to 11. How do you guys plan on continuing to get the message out, get parents to get their kids vaccinated at this point in time to bring down cases?
Will we're making preparations and plans for that messaging. I think the messaging is going to will be very important. But you know, the same way that we've gotten parents to get their 12 to 17-year-olds vaccinated would be a similar thing, except the age group is less, is decreased. But again, the message, straightforward, you know, honest, answer the questions and acknowledge and address the concerns that parents may have, and respect their decisions. And I think people will choose to do what they feel is in their best interest and get their children vaccinated.
Kelly Roberts, WMC.
Hi there. Kind of along the same lines when it comes to kind of the big national news, FDA trying to get, or the Pfizer trying to get FDA to approve the vaccines in younger kids. Can you tell me how much of the current under 18 population that is eligible, the county percentage of the county's population in that age group have gotten vaccinated? And are there any signs, or could you shed any light on evidence that you see that maybe this group of parents for our younger kids may be more enthusiastic to get their children vaccinated compared to parents of the older kids? Thanks.
Well, I really don't have any evidence to say that parents are more eager to have their 5 to 11-year-olds vaccinated versus 12 to 17. We don't, I'm not aware of that, just anecdotally hearing some parents that have called and asked when are the younger children will be able to be vaccinated. And then that really stems from the fact that, you know, schools are open. Kids are back in the class. They are wearing masks, but for the most part, they are 3 feet from each other, or maybe even less. And so parents are interested in having an additional protection measure that would protect their kids, that would keep them from having to be quarantined if they happen to be exposed. And so because of that, parents will be interested and will be willing to have their children vaccinated for that additional protection and what vaccination brings. Not to mention that kids who are vaccinated and not get infected decrease the risk of them bringing the virus home.
And sorry, I know I asked 2 questions in that first one. I just wanted to follow up. Do you have the percentage of our under 18 population in Shelby County that is eligible currently for the vaccine that have gotten that vaccine? Do you have that percentage?
So
Thanks.
yeah, I think we showed a slide to that, and if my memory just off my head, I think it's around 39% that have received. Can we back up another slide? I think we got the slide. We'll get it to you. But if my memory serves me right, I think it's about 39%. Go forward. Keep going. Next. Back to where the vaccination by age, when we have that slide, or did we leave that one out? Hold on, let me see if I got it. Those are cases there. Maybe we didn't have that slide today on there, but I think I got it in my notes to be able to answer that. Okay, yeah. All right, so yeah, it's 39% of those aged 12 through 17 have been vaccinated, and 46.9% have received, at least one dose. So 46.9% of those aged 12 to 17 have received at least one dose, and of those, 39% are fully vaccinated. I hope that answered your question.
Jane Roberts, Daily Memphian.
Oh, Dr. Randolph, I'm interested that the health department is giving vaccinations. Does this mean that you have been given the right to take over the vaccination campaign again?
Yes, so we have received approval and authorization to resume being a vaccine provider. Now, the city of Memphis continues to be a vaccine provider. There are other healthcare providers in Shelby County and Memphis who are vaccine providers. We are one now. We have completed all the necessary requirements, and we are now also one of the 100 and so vaccine providers that we have in Shelby County. We're one of them. We're not the sole, we're not the only, we're one of many.
And do you think that that's the way the status will remain, or will there be an effort to become the main provider again?
No, that would be the status that would remain. We will be one of many providers of the vaccine. And to be honest, that's the only way that we can get people 70% vaccinated. people need to have the option of going to their private doctor, to the health department, to other sites, to the pharmacies, etc., to be able to get the vaccine. One particular agency or entity does not have the capacity to vaccinate all the people in Shelby County.
Those are all of our questions today.
I'm going to invite the Chief back to the podium to close us out, since I've hogged the time.
Thank you, Dr. Randolph, for that update. I think it's great. Great questions today. Just to go back and cover a little of that territory for some of the questions. Fully realize that there has taken some time for people to get up. You know, the older folks, there's a higher percentage of people that are vaccinated because we've done that over time. It's encouraging to see the 12 to 18-year-olds that were already up to almost 50% have had at least one and 40% have had two. To the question about the 5 to 12-year-olds, there will always be early adopters. And when that portal is opened and that authorization comes for 5 to 12-year-olds, that is a huge section of our population that we encourage folks to go take us up on that opportunity to get vaccinated. That will increase our percentage and get us much closer to that 70% goal. So whether or if parents are more willing, there will always be a segment that are early adopters. There will always be people who are waiting to see, and then once their friends go, they will go as well. So we're encouraged by that news. On the question about preparing for the holidays, I think a couple of things come to mind, as Dr. Randolph mentioned. You know, staying the course with the masks on the indoor settings we think is important. Having people continue to get vaccinated obviously is a message we've been putting forth, but also, as I've mentioned before, getting tested and knowing your status early. This is the season when we get into flu. This is the season when many people have allergies as we move into the fall and the leaves start falling. I've said it before, you cannot assume that your symptoms are simply seasonal allergies. You should go get tested so that you know your status early. Excuse me. And that way you could prevent the spread. If you're just assuming that you are sick from seasonal allergies, there's a risk that you could have COVID and be spreading that. So go get tested. I encourage families, if you're going to gather in groups, know your status before you gather and make that part of the prerequisite. Not just who's bringing what dish, but is everybody currently aware of their COVID-19 status, because you don't want to bring people into your home who potentially are positive. So go get tested. It's free, it's easy, and it doesn't take hardly any time. We still have significant capacity at our public testing sites. There's lots of private testing sites. You can still go down to RKS Commercial Cove just off of Lamar Avenue and get a test. You can go to Poplar Healthcare. You can go to South 3rd to Christ Community. Many other on the COVID-19.memphistn.gov website. Please go get a test and know your status before you get together in any large groups. And I think that will be the key to getting us through the holidays. Yes, hospitalizations are down. They're still way too high, more than 100 people in the ICU, 217 people in acute care beds. That's more than we desire to have. We desire 0, but that number is way too high. It's still taking away capacity to treat other very sick people with other conditions, and our healthcare workers are very glad for the reduction, but it's not low enough to give them a break yet. So as the case rate comes down, hospitalizations will follow several weeks later. Several weeks later is when we should expect that. So keep looking for those trends, and please stay the course. Get vaccinated, wear your mask, get tested and know your status, and bring someone with you when you get vaccinated. Thank you all.
Thanks, everyone. We'll see you back here next week.